sinusitis. Did I say that right?
Sinusitis.
Sinusitis. All know too well the pain, the congestion, the headaches, the lack of sleep, and even the depression. I'm feeling all of it right now.
I know. I feel like just over a cold myself, and now there is new relief in a new procedure that is called Propel, but only a few clinics in the world actually offer it. Dr. Madan Kandula from Advent is here to tell us all about it because they are one of the only places in the world to do it. True story.
Yeah, that's true.
Not a lot of people are doing this particular procedure.
In the office, and I was the first to do it here in Wisconsin in surgery, so that was a couple years ago now. And so, we saw the promise of it back then. That promise is sort of coming into fruition right now. So
tell us a little bit about this.
So, basically, concept-wise, it's pretty simple. It does two things. It's something we put in once we have to get the sinus openings open. So if somebody's having sinus issues, even a cold, but if somebody's having chronic sinus issues, those areas are chronically staying shut down.
Because they're inflamed,
They're
right?
inflamed, and then that inflammation causes blockage. So I need to go in, open those areas up. So that's great. What Propel does is it gets in those open spaces, and it's doing two things. One is it's expanding, so it's helping you push on those areas. So it's a drug-eluting stent. The drug part is a steroid medication. So Nasonex or Flonase, those sorts of medications, prednisone, pills that have steroids. Steroids are really very, very powerful anti-inflammatory medications, the most powerful that exist. So what this does is it's embedded with those medications. We get it up in those sinus areas. It basically deposits those steroid medications into the sinus lining, and it dissolves away. So
okay, so this is huge. I'm not a doctor. I don't know if you knew this or not.
I wasn't aware of that. No,
but you watch Grey's Anatomy. So
I watch them on TV.
That's close.
But see, here's what I think is amazing about the way that you are able to deliver this medication. I want you to show how small and flexible it is, because it sounds painful when you think about opening up.
It's not.
But it delivers the medicine right there. So if I take a steroid by mouth, it goes to my whole body or whatever. How do you direct it to your nose? But this actually delivers the medication exactly where it needs to be.
Exactly. Yep. So I've got a couple to show. It's going to be
really
hard
small,
to
so
show.
we're going to try to get
so I'm just going to put them up here. I'll keep talking while we got them.
So it's right here, and kind of turn it to the side. It's a very flexible, very thin.
Bounce it. So
this is where it's folded up, right?
Exactly. That's folded up, and it expands to this bouncy kind of guy. It's made out of suture material, so we've been using that suture material for decades now. So we know how long it stays in there. We know that it dissolves away, usually over about a month or so. That steroid medication gets deposited mostly over the first 2 to 3 weeks. And so, exactly. The big deal with this is we can get it up in those areas, and it's getting up into those areas that there's no other way to get those medications into short of this. So this is a big game changer. This is something that, again, we've been doing this for a couple years in surgery. Now we can do it in the office. So a lot of what I do is moving to the office. So surgery we've been doing for a long time. We're doing lots of things in the office to open up the sinus areas. So that's great. And now this is the next frontier, deliver medications. The first medication that's in here is a steroid medication, which makes a lot of sense. Where this will go eventually is delivering antibiotics, antifungal medications, other things into those sinus areas. That will be a game changer. It is a game changer now. It will open doors to a lot of new treatments.
I think it's just an amazing, excuse me,
She's
as I'm coughing. Can you do this more than once?
You can.
So you could put this in, and then it save you using that spray all the time.
Yeah, exactly. So the times we need to do it, there are times we plan on doing this multiple times, and those are for folks who have polyps. So polyps are folks who have basically swollen growths of tissue that form in the nose, and folks who've had polyps know it's miserable. They come back, and it's sort of an uphill battle. This allows us to do something early on up in those sinus areas, gets the medication right on those surfaces, and I've seen folks who've had dozens of surgeries where we've been doing something like this in the office nowadays, and all of a sudden we can nip it in the bud versus letting things get out of hand.
I think that's just amazing, because you know how much stress is involved if you have to keep going in and having all of that work done. Just to have that one thing
it's elegant, it's simple, it works.
And it seems so less invasive than like a typical sinus surgery, for example, which may still be indicated, but where people, it's very invasive. They pack the nose. There's a long recovery. How quickly can someone expect relief with something like this?
Well, it depends. It's working right away. So when we put this in there, it's putting that medication up on those surfaces. So in a day or two, we're seeing changes. We watch. We can look in with cameras. We're watching that implant stay in there. We're watching sort of that lining open up and sort of melt away. for folks who have polyps, it's pretty amazing where you can literally just see those guys just melt.
And other than polyps, who else is a good candidate? Because when we first started talking, we mentioned people with chronic issues, you know, where it's gotten so far that they might even have depression or can't sleep. Or
it's miserable. I mean, it's just, I mean, you guys know right now what it feels like to have a little bit of trouble going up in the nose and the sinuses. If that's day in, day out, that's your resistance, it's horrible. And so, you know, what this does is, you know, it's able to really help those folks. It's helped folks who've, you know, just with inflammation, polyps, so folks who've had previous surgeries, and it really, swelling can really do us in. So we get in there, get things open, that's great. If somebody has a propensity to create a lot of swelling in the sinuses, then that's going to give us some back push. This pushes back on it.
And you can tell from examining someone if it's appropriate for them.
Absolutely. Yeah, this is not, you know, there are many folks that this is sort of overkill, and there are many folks that this is a great fit. And, you know, again, the nice thing with us having it available in the office is, you know, if it's the right fit for somebody, you're going to hear that from our mouths, and we're going to be able to deliver.
But the first step would be to come talk to you about it.
Absolutely.
I think it's a fantastic solution, especially for chronic issues. You can reach the experts at Advent, the Advanced Ear, Nose, and Throat Specialists. They're located on Mayfair Road in Wauwatosa. Here's the phone number to call for a consultation. It's 414-771-6780 in Wauwatosa. They also have an office that is located in Mequon. That's on North Port Washington Road in Mequon. Again, the phone number is on your screen, and you can also visit them online at advent.md. Always great to see you.
Always great to be here. Thank you.